I may take it.
Would you also weigh in on this issue of hydroxychloroquine? What do you think about this, and what is the medical evidence?
That question?
Yeah.
Maybe
15.
15,
The doctor.
15 times. You don't have to ask.
He's your medical expert, correct?
He's answered that question 15 times.
Is hydroxychloroquine preventative against this virus?
You know, as I've said many times, Margaret, the data are really just at best suggestive. There have been cases that show there may be an effect, and there are others to show there's no effect.
Okay.
So I think in terms of science, I don't think we could definitively say it works.
And what do you have to lose? Take it. I really think they should take it.
It's sad to me that people are promoting that drug. There are studies that conflict a little bit, one from the other. One concludes it has no effect. The other concludes it has a mild effect. The net result is, whatever effect it has, it will be very mild. That drug has been used for years against many other viruses to no effect. The thing that makes me sad about that story is some people may take it who are on other medications, who are other underlying conditions, and may have very serious, even life-threatening consequences. It is not something to take unless a doctor prescribes it.
But hydroxychloroquine, try it if you'd like.
Doctors who are treating coronavirus patients, they have the medical expertise to determine whether or not they should prescribe hydroxychloroquine.
And many of them
And
do.
there are already clinical trials in place looking at hydroxychloroquine.
Sure.
So
They should be finished in about a year.
Why not just let the science speak for itself? Why are you promoting this drug?
I'm not. I'm just
You
saying
come
very
out
simply, I'm not at all. I'm not. Look, you know what I'm trying to do? I'm
Well,
trying
you
to save
come out here
lives.
every day, right, sir, talking about the benefits of
I want them to
hydroxychloroquine.
try it, and it may work and it may not work. But if it doesn't work, it's nothing lost by doing it. If the people walking in prior to getting it, if they take it, it has a profound effect. Well, maybe it does, or maybe it doesn't. I don't want to wait a year and a half to find out. And only CNN would ask that question. Fake news. Go ahead.
So why is Dr. Anthony Fauci, the lead infectious disease doctor in the country, wrong about this, in your opinion?
Sure. I let him speak for himself, John, but I would have two words for you: second opinion.
What are your qualifications to weigh in on medicine more than Dr. Anthony Fauci? Why should we listen to you and not Dr. Fauci?
Doctors disagree about things all the time. My qualifications in terms of looking at the science is that I'm a social scientist. I have a PhD, and I understand how to read statistical studies, whether it's in medicine, the law, economics, or whatever.
I'm sorry, that doesn't qualify you to treat patients. You know it doesn't qualify you to treat patients. Do you want an internist striking trade deals with Asian countries?
The Annals of Internal Medicine, which is the journal for internal medicine doctors, which are taking care of hospitalized patients, they have a very strong opinion on this, which is that, you know, as doctors, we learn primum non nocere, which means first do no harm. At this point, we don't know that we're not doing more harm than good with these drugs. So if somebody's dying, then that's one thing. But we have a president who's telling people that they should go get their doctor to prescribe these. And there are people that have lupus and have rheumatoid arthritis that are in acute crisis, having actually kidney problems and rebounding off of their medications because they're not available. There are some physicians and other healthcare workers who actually have been hoarding these, which I find to be despicable.
We bought massive amounts of it, 29 million doses of it. We have it coming from all of the labs. We're actually now doing it here because in case it does work, we want to have it. I keep talking about hydroxychloroquine.